Hi there, folks. My name is Emily Moore, and I'm the Policy Analyst at Voices for Virginia's Children. I cover our healthcare access and social determinants of health policy portfolio, and I'm here today to talk to you about Medicaid unwinding, what you need to know, and how to prepare. Over the last 2 years, Virginia has seen a drop in the rate of uninsured children. This is largely due to continuous coverage requirements for Medicaid that were available during the federal public health emergency and will be coming to an end. During the early days of the pandemic, federal law mandated that during the public health emergency, no one could be disenrolled involuntarily from Medicaid or have reduced coverage, even if their eligibility would have otherwise changed. In return, states received enhanced federal funding to support their Medicaid programs. Over the course of the last year, there's been a lot of uncertainty about when the public health emergency would come to an end. And as a result, when states would need to begin doing outreach about the year-long process of redetermining Medicaid eligibility for all recipients, which is referred to as Medicaid unwinding. Well, at the end of December, Congress passed and President Joe Biden signed a $1.7 trillion Consolidated Appropriations Act, which is a big spending package, also referred to as an omnibus, that funds the federal government for their next fiscal year. This omnibus bill included some changes to Medicaid, the biggest one being that it created an end date to the continuous Medicaid coverage requirement that was originally tied to the federal public health emergency. By decoupling the Medicaid continuous coverage requirements from the public health emergency, states now have a date that they can begin the unwinding process. So on April 1st, all states can return to the normal enrollment processes, which includes doing redeterminations and processing reductions or closures of coverage for Medicaid enrollees. Virginia is initiating its first month of redeterminations beginning in March. Remember, this is a year-long process, so not everyone will have their renewal completed in March. Virginia plans to do renewals in batches on a monthly basis over the 12-month unwinding period. The important thing for folks to keep in mind is that reductions or closures of coverage will not begin until after April the 30th. So you might be curious how many people this will impact or what the impact will look like across the state. In Virginia, Medicaid enrollment has grown during the public health emergency to more than 2 million individuals. According to a new report by the Georgetown University Center for Children and Families, enrollment in Virginia's Medicaid and FAMUS programs grew by more than 160,000 children between March 2020 and August 2022. Virginia's growth rate of children enrolled in Medicaid and FAMUS was 21.2% and ranks Virginia 15th highest in the country. Children comprise nearly 46% of enrollees in our Medicaid and FAMUS programs here in Virginia. During the unwinding period, the Department of Medical Assistance Services, referred to as DMAS, estimate that 14% of members will lose coverage, and an additional 4% of folks will lose coverage but re-enroll within a few months, referred to as churn. That estimate would mean that a loss of coverage for 146,452 of Virginia's children is possible during the unwinding period. A subset of folks who will be disenrolled will be improperly terminated for administrative reasons. This could be because maybe they didn't get their mail or they didn't return their redetermination paperwork in time. Other folks will be disenrolled because they're no longer eligible for Medicaid coverage. Maybe they got a higher paying job during the public health emergency and they're no longer eligible under the income guidelines. For these folks, it's imperative that they receive a referral to the federal marketplace and information about other healthcare coverage options that they might be eligible for. So, what is Virginia doing to ensure that this is a seamless process? Before we had an official date to begin the unwinding process, Virginia's Secretary of Health and Human Resources, John Littell, convened a task force on eligibility redetermination to evaluate Virginia's plan for the unwinding period. Stakeholders from DMAS and the State Department of Social Services have been working diligently to prepare a plan for how their agencies will handle this undertaking over the 12-month unwinding period. Thankfully, Governor Youngkin included some funding in his introduced budget to support those state agencies during this unwinding period. His budget proposals include $20 million in ARPA funding for DMAS to procure a one-time vendor to assist in the redetermination of Medicaid enrollees, and another $10 million in ARPA funding for the State Department of Social Services to fund one-time costs of making overtime pay available to local DSS eligibility staff to perform these redeterminations over the 12-month unwinding period. Voices is a member of the Healthcare for All Virginians Coalition, and we provided recommendations for the task force on eligibility redetermination and state agencies to consider as they begin the unwinding process. A couple of the recommendations from the Healthcare for All Virginians Coalition include additional stakeholders that will work with or on behalf of Medicaid members in the unwinding planning process. The inclusion of non-governmental organizations that regularly engage with folks enrolled in Medicaid and FAMUS will be a critical component to amplify important messages and assist enrollees with the completion of required tasks and understanding the paperwork that they may receive. We also request that the state make data available on coverage terminations by reason, age group, citizenship status, and race and ethnicity, and have that data publicly available on a monthly basis. By identifying specific needs and gaps, the administration and their partners can develop a targeted outreach plan and interventions. And this is truly a critical component because according to estimates from the Federal Department of Health and Human Services, coverage losses, despite remaining eligible for Medicaid and FAMUS, are expected to disproportionately impact children, Latino individuals, and Black individuals. We also anticipate barriers to being notified and to completing the renewal process for non-citizens and those with limited English proficiency. These disparate impacts will only deepen existing health and coverage disparities here in Virginia. So if you're tuning in and you're a Medicaid member, there's a few things that you should do to prepare. Starting in March 2023, caseworkers will begin reviewing members' coverage. They may be able to renew your case without asking you for anything. And if so, you'll receive a letter in the mail letting you know that your healthcare coverage will continue and there's nothing that you need to do. This is called an ex parte renewal. If they do not have all of the information necessary to renew your benefits, then your caseworker will send you a form or a checklist to complete and return. Make sure that you keep your eyes out on the mail and that if you do receive this letter, you return it before the deadline. You can and should take some steps now to ensure that you get the information that you or your family needs to stay covered. The first and most important is to keep your contact information up to date and report any changes to your address, your email, your phone number to Cover Virginia or to your local Department of Social Services office. Virginia Medicaid will also be sending out some important updates in the mail, so keep your eyes out for letters containing information about your coverage and steps that you may need to take in order to keep it. And then again, watch for and respond quickly to any notices about coverage before the deadlines. If you do lose coverage and you're not sure where to turn, you can contact Enroll Virginia. They have navigators that will provide free help and support in order to let you know what other options you may have available for healthcare coverage. Their statewide helpline can be reached at 888-392-5132. So that is where we currently are in Virginia with Medicaid Unwinding. As I mentioned, the most important thing for folks to do right now is, if you're a Medicaid member, ensure your information is up to date and keep your eyes out for mail about your Medicaid coverage. If you're a community partner or an organization, stay up to date and educate folks that you support that have Medicaid about unwinding and the steps that they can take now. Cover VA and Enroll Virginia have many resources available to educate folks about this process and what steps that they can take. Thanks for tuning into this vlog on Medicaid Unwinding. I invite you to stay plugged into our blogs and our social media channels as we share pertinent information as unwinding begins. Thanks and take care.